Hi, I'm Dr Cronin, Specialist Plastic Surgeon at the Coastal Clinic, and today we're talking about breast reduction surgery. Breast reduction surgery is a very common presentation for women to a plastic surgeon. The primary reason for most women is the neck and back pain that's caused by being encumbered with large, heavy breasts. Some women, particularly here on the Gold Coast, will have problems with rashes and skin breakdown under the folds of the breasts as well. Women may have grooving of their clavicles from having to wear bras to help support the weight of their breasts. Women often say that they feel very uncomfortable trying to exercise or stay in shape, or may need to wear 2 sports bras to go for a jog. Often it's difficult finding clothing that fits appropriately or fitting into dresses that they might like to wear. And essentially, the overwhelming feeling is that being really large-breasted just makes every part of their day harder. It makes doing the shopping harder, looking after the kids harder, doing work harder. And so breast reduction surgery is one of those very happy operations that we have in plastic surgery, because the procedure itself is a day procedure. The recovery is typically very straightforward, and it's an operation that's very effective at significantly improving those symptoms for those women, and the results are instantaneous for them. Reduction surgery is a day procedure. There are slight variations in how it can be performed based on the shape of the breast and the amount of breast tissue that needs to be removed. But for the purposes of illustration, we'll discuss a patient that has quite a large amount of breast tissue that needs to be removed, with a lot of excess skin and a low nipple position. And those patients would require what's referred to as a wise pattern, or the anchor scar, where there is a scar that's around the nipple, a scar from the nipple down to the fold, and then a scar that runs underneath the fold. During the procedure, markings are made on the breast to decide where the new nipple position will be, how much laxity or excess there is in breast tissue and skin, both left and right, and how much excess skin and breast tissue there is vertically as well. And so the skin incisions are marked on the breast, and a pedicle of breast tissue is left behind to provide a blood supply and ideally a nerve supply to the nipple, and all of the rest of the breast tissue and that skin is removed. The nipple is then moved into its new position on the pedicle of breast tissue that remains, and the skin is closed down around to provide that scar. And that's for about 95% of breast reductions that I'd perform here at the Coastal Clinic. Initial breast reduction consultation, I'd speak to the patient about why it is that they'd like to undergo a breast reduction, what symptoms they currently have from their large breasts, get an idea of what size cup they're wearing at the moment with regards to their bra, and what they feel their ideal size would be as well, to get an idea of how much breast tissue they'd like to have removed. I'd also go through with them their medical history to ensure that it's safe for them to have a procedure like a breast reduction, and then examine them and assess how much excess breast tissue and how much excess breast skin they would need to have removed in order to achieve their optimal result. I'd then explain to them and draw for them in detail what's involved in that procedure, and give them an idea of what they could expect themselves for their post-operative recovery, and then their return to work, exercise and normal activities of daily living. Recovery from a breast reduction, or the downtime associated with breast reduction, is similar to some other breast procedures as well. It's performed as a day procedure, so patients will wake up in recovery in their post-operative garment, and all of their wounds are taped. The vast majority of breast reduction patients don't require drains. One of the common feedback that we get about breast reduction is that patients really felt that they would be in more post-operative pain than they had. The vast majority of patients will be off their pain relief after a few days and will feel quite comfortable. And that's coupled with the significant immediate improvement in symptoms like neck and back pain and grooving of the clavicles from wearing a heavy bra. Most women will feel comfortable driving the car to come and see us at their post-operative review at 1 week. And depending on what they do for work, most women will feel comfortable going back to work after a week or two. Again, I recommend to patients that they don't do any exercise that's going to cause them to sweat for the first few weeks post-operatively. And again, that's more about keeping the wounds clean and dry from their surgical incisions. And most women, when I see them at the 6-week mark, are able to go back to all of their pre-operative activities and exercise. It's important to remember that breast reduction is also coupled with a breast lift. And so putting the nipple back into the correct position and tightening the breast so that it's not just a smaller breast, but it also has a normal youthful breast aesthetic. Now obviously skin has a capacity to stretch, and so during that procedure, on day 1 post breast reduction, patients will feel like their breast is still sitting very high, that their nipple position's very high, and that the breast has a shape of almost like an upside down breast, that the curvature is at the top of the breast and then it's really tight down onto the incision that comes along the inframammary fold. It's important to remember that over the course of particularly the first 6 to 12 weeks post-operatively, that breast is going to drop down into its normal position, and that there will also be some immediate post-operative swelling that recedes over the course of those first 6 weeks. Now, patients will often ask if the results of a breast reduction are permanent, and obviously if there's no huge fluctuations in the patient's weight, we would not expect that their breast to get larger again or smaller again unless they were to fall pregnant and breastfeed further children. But all skin on the body is under the influence of gravity every day. And so just as with all women, their breasts will be sitting in a different position at the age of 70 than they were at the age of 20. Even breasts that have had a breast reduction procedure performed will also experience that same gradual descent and ptosis over the years. I have seen a number of women who had breast reduction surgery 30 years ago and then had changed in size and put on weight and lost weight and required revisionary surgery, but for the vast majority of women they would only ever have the one procedure. To discuss breast reduction surgery, please contact the Coastal Clinic to organise a consultation, and I look forward to speaking to you soon.